Welcome back, everyone. You are watching Insight. Right now, we are here on location at Stepping Up Physical Therapy, and we are here with one of the physical therapists here. Riley, we appreciate you being here with us.
Thank you for letting me talk.
Yeah, no, look, we're talking today about dry needling. So what exactly is that, and why would someone need that?
Yeah, so dry needling is where we take a thin monofilament needle and we put it inside a dysfunctional muscle. So whether that muscle is tight, whether it hurts, different reasons. But when we put the needle inside the muscle, we expect there to be a pretty immediate change, whether that's a neurological response, whether we're promoting more blood flow and getting better oxygenation to the muscle. And it's usually effective for pain, maybe improving your range of motion, even just the immediate perception of increased strength. So those are some of the main reasons we would utilize it.
Do people normally get this similar to acupuncture? Do they normally assume that this is acupuncture?
Good question.
It's a difference, right?
There is. There's a big difference. So the similarity is primarily the tool used. So we have very similar needles. We've got, we have our tube, pull the needle out. It's a pretty small, thin needle. However, the way that you use the needle is going to be much different. So with acupuncture, the methodology is going to primarily be following a Middle Eastern belief system of the energy flow in the body. You're going to put it in similar positions to energy, chi lines, and that's just not what we're doing with dry needling. So we're trying to find a problem muscle. So let's say in your upper trap, in your bicep, whatever it might be, and then we put the needle inside of it. We expect that right away. I should be able to test if you can move your arm better, if you can bend your elbow better, if it's less painful, and we're looking for a pretty immediate neurological response.
Now you say immediate response, but if someone says, well, this cure whatever I'm going through or just automatically fix it, how does that work with people, assuming that it's going to cure everything?
Right. So it's a great tool in a toolbox. So every carpenter is going to have his hammer. He's going to have other things involved. While the hammer's great at nailing things into the wood, it can't do everything. So just like this, we might be able to bring the pain down substantially. It might allow you to move better, but that's not going to be the only solution. You're going to want to follow up with exercising, a little bit of massage perhaps, and then continuing to develop the right things to get you to the point where you don't need us anymore.
Yeah. And how do people know to say, okay, I want to go in for dry needling? Is that just something they just choose to do, or is it something that's more so recommended? How do they decide whether or not dry needling's for them? That's
an excellent question. It's going to be primarily up to the therapist that you see. Okay. So when they're treating you, they first got to evaluate you. So that's where I come into play. Any other physical therapist themselves, they're going to see, are you a right candidate for it? But primarily, we're going to see, what are you experiencing? What is bothering you? How you can get that better? And then if you're a good candidate based on your comorbidities, other diagnoses you have, where on your body is bothering you, and then the condition, the impairments that are there, and then we can talk, well, I think you might get better with this, but it's always just, it's one of our options. We'll pick it, we'll bring it back into the play, but then we're always just going to be treating everyone based on their individual presentation.
Riley, when people come in here, I know that you guys specialize in one-on-one care.
Absolutely.
When people come in, what kind of experience can they expect? I mean, you being one of the physical therapists, what can patients expect when they come here?
Yeah, so it's great that we're in this room. We would actually bring them into the room. I'd probably sit right there or in front of them based on what's happening. They could take a seat in their chairs or our table, and then we'll talk a lot. We'll talk about what is happening with you, what has been bothering you for a while, how is this impacting your life? Are you not sleeping? Are you not able to play with your kids? And after that, we get a good lineup of what has been happening. We can start looking at what is moving bad. So let's say it's your neck. Is your neck moving? Okay, great. If it is, perfect. We'll check out the shoulder. And then we'll just kind of go down the path of what is limited, what is bothering you, and then start giving you some options to treat it. We can even make a lot of progress the same day.
Yeah, and that's where then people can say, okay, and figure out if dry needling may be for them after they get that evaluation,
Yeah,
right?
exactly. We can even sometimes do it same day, and then you can get that, again, I like to test, retest. I think that's a good practice. So, can't move my neck. Do some needling to maybe the upper trap. Oh, hey, look, it moves a lot better. So it's just fun things to kind of test out. But obviously, the goal is to get someone better, not just have fun.
Exactly. Well, thanks so much, Riley. We appreciate you all's spirit and the great work that you do here.
Absolutely. Thank you, Tony.
All right, everyone, take a look at your screen right now. You can find more information about Stepping Up Physical Therapy. You can get yourself in here and get better. We'll be right back.